Hello, my name is Amber and I'm a family nurse practitioner, and I was born and raised in Houston, Texas, and that's where I currently reside. I've been a nurse for almost 10 years now, which is so crazy to say, and I've been a nurse practitioner for almost 5 years. When I was a registered nurse, I worked in so many different specialties, including med-surg, PACU, ICU for 2 years, and I became a nurse practitioner after I was a registered nurse for about 3.5 to 4 years. I love being a family nurse practitioner. I actually got my master's at the University of Texas in Houston, and I love it. So a family nurse practitioner is trained in the entire lifespan of the person, from pediatrics to adults to geriatrics. I actually work in a school-based clinic, which I see adolescent patients that are at the school. So that's ages 11 through 18. And I love it. I love forming a relationship with the students and treating them. So stick along as I take over Nurse.org. Hey y'all, happy Tuesday. I'm so excited to be taking over Nurse.org today. It is 6:30 in the morning. I'm about to head to work. I just packed my lunch, so let's see what I'm packing. So I have some chicken enchiladas, which I was craving, so I made them. I usually try to have a vegetable with my food, so I have some cucumbers and tomatoes with some seasoning. For breakfast, I have some oatmeal. These oranges are so convenient and cute to carry at work. A bar and some supplements. And I have to stay hydrated, of course. So I have my fruit infuser water bottle. I just have cucumbers in here, but sometimes I put like lemon, lime, mint, strawberries. You can really put anything you want in these, and it just makes drinking water throughout the day so much easier. Hey y'all, so I'm on my way to work. In the morning, I like to listen to something that will uplift me, like gospel or a sermon or like a motivational video on YouTube. Medicine is unpredictable, so you just have to get your mind right before work. So I usually get to work at 7 a.m., which is so early. But I think at this point, my body has somewhat adjusted to it. So yeah, but it's still pretty early. So I can do everything that a regular nurse practitioner can do in a standalone clinic. So I mainly see patients for well child exams, chronic disease management and follow-ups. We do vaccines, blood work, anything a full service clinic can do, I can do in a school. So what motivated me to become an NP was the fact that obviously the salary is better, but also I get to actually treat the patient on a more personalized level. I could have more flexibility with my scheduling, and I just wanted to advance myself in my career. So I do advise you to get some experience with your BSN before you go to get your master's degree, only because you just want to have like a foundation. You want to have that experience. It's going to help you a lot in NP school, no matter what type of NP you decide to become. So this is a good question. When I don't have the answer to a patient's question, I'll be honest with them and tell them that I don't know, but I will find out. So I try to look it up on UpToDate, or I'll consult with a colleague or my supervising physician, and I try my best to figure it out. So as a family NP, most of my job opportunities are outside the hospital or in clinic or outpatient settings. Now, there are some FNP jobs in the hospital, but most are outside the hospital. Now, in outpatient settings, I can work in pediatrics, adults, geriatrics, OB, women's health. So like most FNPs, my hours are normal clinic hours, which is usually Monday through Friday from like 8 to 5-ish. Now, since I work in a school-based clinic, I actually work on a school schedule. So usually I get here at 7 and I leave at 4:15. On Fridays, I leave at. So although the NP job market may feel saturated, I advise you to still do it, because the job outlook is expected to be above average for nurse practitioners, meaning there's going to be a tons of jobs in the future. So nurse practitioners are not going anywhere. So if you really want to do it, do it. Hey, so I just got back from work, and it was actually a slower day today, so not complaining. So as far as my nursing journey, like I stated, I've been a nurse for about 8.5, 9 years. I graduated from Chamberlain College of Nursing in December of 2013 in Houston with my BSN. I worked at the bedside for about a year to year and a half until I applied for my master's at the University of Texas. I got accepted into their FNP or Family Nurse Practitioner program. It took me about 2.5 years to get my degree. I did go to school part-time and I continued to work full-time throughout my entire master's journey. So that was fun, very busy, but absolutely worth it. And I do not regret a single step in my journey. So I chose to be a family nurse practitioner because I really love that family nurse practitioners are trained to treat a person no matter what age they are. So from infants to geriatric patients. I actually get bored really easily. So I wanted to have a degree that was diverse to where I can move around and work in different specialties and just really have that flexibility that I need in my life. I also chose to be a family nurse practitioner because I really wanted to treat the patient in more of a preventative way. So family nurse practitioners typically don't work in the hospital. We work in clinic settings. And in that type of setting, I feel like I'm able to really educate and follow the patient on a more long-term basis versus an acute basis. And I can really track their progress and see that what I've done as a provider is really making a difference in their life. So I like that aspect, and I love the scheduling that family nurse practitioners typically have, which is typically like Monday through Friday, 8 to 5, no weekends, no holidays in most cases. And yeah, that is a really big perk. So with me being a family nurse practitioner, I can actually act as a primary care provider. I can see patients for their annual checkups. I can order blood work, vaccines, diagnostic testings. I'm able to diagnose, prescribe medications, refer to specialists. So I can do a lot with my license. Now, since I live in Texas, I do have to have a supervising physician if I wanted to open my own practice. But for the most part, as far as my job, I'm pretty autonomous, meaning like I'm the only provider in my clinic. So having that freedom is really nice.